Hello, hi everyone. Again, I hope you are doing good. We will start today's class from where we stopped in the previous class. Okay. Yeah. Yesterday we discussed importance of anatomy and what are the prefixes, suffixes, outpatient coding, what is instrument coding, previous suffix, root operations for the ICD-PCS, what is the suffixes for the surgical procedures as well as suffixes, prefixes for the diagnosis. Today, I am going to discuss about ICD nomenclature, which is used to present diseases. Okay, what is ICD coding and what are the guidelines we have to follow for coding the reports appropriately. First, diagnosis part. Okay, we have to follow whatever the guidelines dictated by the ICD-10-CM for clinical modification. What is the ICD-10-CM? It is a clinical modification for US. Okay, it is a clinical modification for US, which is governed by CMS. CMS means Center for Medicare and Medicaid. Okay, Medicaid services. Yeah. What is CMS and what is the use of placing this on top of everything? Whatever the insurance guidelines and whatever the nomenclature and all these are monitored by whatever CPT, insurance, billing, payment, classifications, vacations for both inpatient, IP, smartphone, IP and OP. Okay, all these are monitored and governed by the CMS only, Center for Medicare and Medicaid Services. It is the funding. Funding will come from US government. Okay, for managing all the guidelines, structure, and code systems, all these things. In US, the government will allot. US government will allot some budget yearly for medical services for US citizens, underprivileged, elderly patients with ailments, chronic diseases or ailments. Okay, and children, pregnant ladies, children up to age 5. US citizen only. Okay, government will allot some budget yearly for medical services for US citizens, underprivileged, elderly patients with chronic disease, pregnant ladies, children up to age 5 are taken care by the US government without any budget constraints. For whatever they will spend, they will spend. But if they provide all these things without any governance and all these things, the people may misuse that budget to inadvertently gain some profits from the Medicaid and Medicare service. Due to that, they will stipulate some governance rules and guidelines to control the usage of the government budget. They will the US government and CMS will generate uh, conversion factor like one thing based on the conditions in the country and other situations. So for suppose they will pay on the conversion factor value is 2.6, I think. For suppose for some states it will be based on the states and based on states the hospitals on the 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 tier of the hospital. Based on that, the conversion factor may be different. Here is basic idea of how they will manage the budget, hospitals and other things, okay, etc. They will decide the conversion factor, okay, for suppose 2.2, 2.6, like that, 2.7. For they will manage CPT, ICD, ICD-CM, ICD-10-CM. Currently, ICD-10-CM is the in US. Okay, ICD classification, clinical modification for for US. Basically, ICD-10 was developed by World Health Organization to statistics purpose. Will develop ICD-10 system for statistics, disease statistics, all these things. They will monitor. They will develop the ICD-10 system. Okay, all the health organization, but they are the US modified their ICD-10 for their circumstances in the US and culture. They following the diseases and disease prevalences. They modified circumstances to ICD-10-CM clinical modification for the US. For Australia, it will be different AS or something. Okay, we have to follow the in the for care provided by the US hospitals for the US citizens in the US. It will be built under reported with the ICD-10-CM current modification. Okay, it will be based updated on October 1st effective. Any modifications done over the year will be updated for October 1st. It will be effective for October 1st to next year September 3rd, September 1st, 30th. Okay. When the patient is discharged on October 1st, the guidelines will change. Whatever the modifications, any modifications will take effect on the October 1st discharge. Okay. The CPT from January 1st. Just remember, January 1st every year. Any modifications in the CPT code system will be effective from January 1st every year. Okay. If some suppose some coding conventions changed for CPT and the code definitions are changed. Okay. So colonoscopy 45378. They modified modified some definition, modified definition. Okay, definition. For suppose it will be effective from January 1st discharges. Okay, for one ICD, for one ICD, for suppose M7514. Okay, for suppose they modified the definition. CMS modified definition of M7514. Okay, so it is applicable for October 1st discharges onwards. Okay, you have to report whatever the changes after October 1st only. For September 30th discharge, there will be we use the previous definition of this M7514. After the October 1st, we have to use modified version. Okay, it is the concept. Most important dates are January 1st and October 1st. For ICD, it is October 1st. For CPT purpose, it is January 1st. Any modifications in the definitions and nomenclature and if any guidelines, any conventions will be take effect on January 1st discharges onwards. Okay. For CPT, for any ICD changes and any modification, any updated guidelines and all will take effect on October 1st. Please make a note of it. It is very important. Okay. ICD-10 quantification for say the US. Okay. We are talking about today conversion factor based on the every CPT has a revenue value. Okay, both professional and technical. Every CPT will have rev value. Okay. Value. Both professional component, professional work component, and facility. I will show you how to utility component, malpractice. Like this, they have some revenue values. Yeah, we have to check initially the code book to go through the go to guide the whatever we are getting the code in that. It is a dummy CM 3M. We will use that 3M software in our code and day by day work practices, but it is an educational one. 3M HSS LCC via education launch. It is a free version provided by the K3M software. It is not always up. Okay, if the logins are more, it will be show an error, server is busy. Okay, sometimes for education purpose only they are allowing the people to log into this using that TMHAS LCCC EY education. No, it is not always up. Have to check it is up. If it is okay, we can use. If not available, we have to use the code books. Our code books, whatever the code books ICD-10-CM, ICD-10-CM, 10 PCM for CPT, ICD, and for CPT, you have to use CPT book. If for God's sake, it is available today. Okay, I'm 3 MCS. Okay, if I use that, okay, it will open up. How to use the hand? I will show you. Okay, you have to use this tool to code CPT and as well as ICD. Okay, you have to check whether the patient is male, female, or other. For the coding, general coding purposes, we will use other. Okay, most probably we have to use other For female and some code physics are there. For female patients, some procedures are allowed. Some for female patients, some procedures are not allowed. Like that, they will come in original practice. You have to take the patient's gender, and we have to find the DRG finder, code finder, for MC. We will use APC finder for outpatient purposes. Okay, Medicare guidelines, APC, HOPD, hospital. Okay, Medicare, APC, ambulatory payment classification, HOPD, outpatient hospital, something. Okay, HOPD. Continue. For billing type, hospital outpatient, that is with condition code, clinics only, home health only, special specialties, all other facilities. Okay, you are using hospital, not condition code. Primary diagnosis. What is the main reason for the patient has been to the hospital after workup? Suppose the patient come in with cough. After workup and all the diagnostics, the doctor diagnosed pneumonia in our previous case. Na? Pneumonia, you have to go code pneumonia. It will show error if you find any pneumonia. Okay, ammonia. The theorem will generate code selections based on the whatever the tabular index in the ICD-10 ICD-10-CM. Okay, you will use convention. Whatever the guidelines, you have to follow ICD-10 guidelines. The convention general guidelines and chapter 6 guidelines are applicable to health settings and otherwise included in convention instruction of the classification provision of our guideline. Convention for the course alphabetical and we will use for code selection alphabetical first, and after that we find the code in the alphabetical index. We will go to tabular list for exact code. Okay, first we have to code alphabetical index to go to for alphabetical index and tabular list. After that, okay, I will show you how to go to alphabetical list. It is available in the 3M. Okay, it is the alphabetical list. It is Asperger syndrome. It is the first code. Abandonment to abiasia, like that. Okay, you have to check pneumonia. Pneumonia is same as book alphabetical index. Okay, what will show? It will with acute lung abscess due to specified organism. If they documented for due to any organism, any bacterial organism, we have to do. Due to with influenza, if the patient has pneumonia with influenza with pneumonia will come. Adenoviral, it is adenemic like this. It is allergic pneumonia, it is pneumonitis hypersensitivity. Alveolar pneumonia, lobar pneumonia. Okay, if they tell pneumonia alveolar, we have to code C, pneumonia lobar. Pneumonia anaerobes, due to anaerobes, you have to code G15-8. Pneumonia due to anthrax, A22.1. Pneumonia apex apical. It is a location. There is the apical lobe only, but they are selling apex apical. Pneumonia in the apical lobe of the lungs. So you have to go pneumonia lobar. It will show you how lobar J18.1. It will go to tabular list. Tabular listing it is. Right. Left side is the alphabetical list next. Right side is the tabular list. We have to go J18.1. It is the most specific one. If there is any further code, it will show indentation. Okay, you have to code complete code J18.1 lobar pneumonia unspecified organism. For suppose it is pneumonia here, no specification was provided by the provider. Pneumonia unspecified. What is it come? J18.9. J18.9 is unspecified code. J18.1 will report unspecified. No, associated influenza. It will be asking associated influenza. No. The 3M is asking whatever the entries it found in the alphabetical index. Pneumonia, the provided with influenza, lung infection, no. Congenital, no. Neonatal, no. There are guidelines you have to follow based on the patient's age also. If the patient is a neonate under 28 days of age after birth, it will go to neonatal. Okay. Pneumonia with influenza lung abscess, it will go to this code. Congenital. congenital pneumonia infective. It is neonatal means under age 28 days. Pneumonitis due to external agents, some anything aspiration pneumonia due to aspiration, bacterial pneumonia, hospital acquired. Okay, it is a very important. Okay, so communal condition may be assigned as action code when documents support the hospital or healthcare acquired condition. Okay, it will give nosology help messages. What are the messages to code us to guide the code selection? Okay, whatever they comes in question mark, we have to read them thoroughly. Lobar disseminated, double, interstitial. Both these are non-essential modifiers. It will not depend on this. Okay, you don't select the code depending on the documentation of disseminated, double, or interstitial. They have to document lobar. Okay, the doctor has to tell lobar pneumonia. If the doctor tell document like that, pneumonia disseminated, we don't take lobar. The doctor has to dictate lobar, not disseminated. Whatever they mentioned in the brackets, parentheses are non-essential modifiers for the code selection. They will guide, but we have to find the documentation for lobar. Viral, broncho, interstitial, lobar is non-essential modifiers. Okay, suppose they don't, what is other specified? The doctor documented some specificity, but it is not available in the classification. Yeah, pneumonia, suppose pneumonia, okay, due to COVID. Okay, for suppose COVID is not there. Okay, for suppose there is no COVID pneumonia due to COVID is not there. If the COVID is there, we have to take the COVID diagnosis related to COVID. Not exactly. I'm trying to what I'm explaining, trying to explain to what is other specified, what is unspecified. Okay, it is not available. Okay, pneumonia with COVID. Okay, if the other spell COVID pneumonia, if no to COVID pneumonia is there with aspiration pneumonia, no specified. Do not code. Do not. Do not. COVID-19 other viral pneumonia. It will come. Sometimes this COVID-19 pneumonia will not be there in the classification. At that time, we have to take the back, 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 back. Other specified only. For suppose some specified organism is there, associated pneumonia is there, not there. Other pneumonia will come. J18.8 other pneumonia unspecified organism. If the classification does not have a code for the whatever the disease specificity the doctor has provided. Okay, we have to code other specified codes. If it is doctor was not specified anything, just coded, just documented pneumonia, we have to take the unspecified. Okay, J18.9 and J18.9 is unspecified code. Okay. J18.9 is the unspecified one. J18.8 is other specified. There is a slight, very crucial difference between the other specified code and unspecified code. Unspecified means the doctor has not provided the specificity. Whether it is a pneumonia, aspiration pneumonia, lobar pneumonia, bacterial pneumonia, viral pneumonia, COVID pneumonia, like that. If the doctor provides them some specificity, any kind of thing specificity, pneumonia due to some respiratory syncytial virus, pneumonia due to some new organism, okay, whatever the disease may be, okay, due to other reason, okay, the classification doesn't have that specificity in our code book. We have to code other specified only at that time. Okay. In case of Z18 point coding pneumonia in what I discussed in the in demo class, I try to code that scenario using 3M as well as code book. It is alphabetical index. It is in tabular list. Whatever that you got in an alphabetical index, you have to check pneumonia. Pneumonia unspecified organism. The doctor didn't provided any specificity regarding the whatever the organism and what causes pneumonia. Okay, we have to code J18.9. It is the most specific one. Okay. If it is not specific, it will show an error like that. It is not specific, not able to code. We have don't code, not we have to select the code to full classification definition. If it is some missing, it will not code, it will not codable. Okay. I will show you how to check for the full code description. We have to follow the guidelines provided by the ICD-10-CM conventions, general coding guidelines, and chapter specific guidelines. I will read through and explain all these things on it. If whatever possible thing, I will give an explanation using example also. Okay. Yeah, I'm just reading. Please go through. If you have any code book available, it will be in the official start pages of the code book. Probably in ICD-10-CM, it is a G3 space. Okay. You have to read thoroughly the guidelines from page 1 to whatever the page they have documented in that. It is around 5 pages or something. Keep it handy. Okay, if you are a new coder, you have to keep it handy. And if you have any doubt, you have to go to the ICD guidelines and check that guideline regarding any guideline changes, guidelines, so conventions and all these things. If you have any doubt, you have to go to this part of the ICD-10 book and check it. It is available in the internet also. ICD-10 clinical modification guidelines in PDF format. Okay. Official guidelines for CMS, Center for Medicare and Medicare Services guidance. Official guidelines for CMS. Access denied. Okay. PDF we have to check. Yes. What health organization guidance for PDF. CMS we have to take the guidance from CMS most probably. Okay, access denied. Okay. Volume 1. Center for manual 2001 and 2004. I think that's 16. Official guidelines applying optimum coding, HMC and condition changes summary. Okay, whatever available, you have to check the official one. Okay, not other modifications. You have to take the modification, clinical modification of the US only. Okay, there may be some different of coding conventions and guidelines in the other countries. Maybe in the Australia, Canada, they will use different conventions based on the circumstances in the country and the disease prevalences in the country. Like that, they will change the definitions of the some guidance and all these things in their countries. So we as a coder working for the US hospitals, we have to follow the ICD-10-CM official guidelines for coding and reporting for fiscal year 2025. Fiscal year means October 1st to 2024 to September 30 is applicable for fiscal year 2025. If they told applicable, they said that it is applicable from fiscal year 2026. It is October 1st, 2025 to September 30, 2026. Okay, like that we will be follow. Whatever the changes documented sent by the CMS applicable for ICD-10-CM, it is fiscal year 2 to October 1st to 20 September 3rd. If for in case of CPT, it is January 1st every year. Okay, any new changes, new code modification will applicable for CPT from January 1st every year. Okay, that's it. Yeah, I'm reading Convention for ICD-10-CM. The Convention for ICD-10-CM are general rules for use of classification independent of the guidelines. whatever the guidelines, they may the facility will dictate. Okay, the facility has some guidelines, client specific guidelines. Some different for hospitals will have some different kind of guidelines, and some are different. So we have to follow whatever the client specific guidelines are different, but the most precedence will be for conventions provided by the ICD-10 official guidelines will be take precedence over the client specific guidelines. They will use some guidelines regarding the pertaining to that facility, but coding convention will take precedence unless otherwise specified by the specific hospital. Okay, the the conventions for the ICD-10s are general rules for use of classification independent of the guidelines. These conventions are incorporated within the alphabetical index and tabular list of essentially as instructional notes. These are conventions are used to develop tabular list and index. Okay, they are the index and tabular lists are developed based on these guidelines followed by the CMS. Okay, you have to make sure that these conventions and guidelines are strictly followed throughout our coding. Any deviation from these conventions and any specific chapter specific guidelines, it will lead to a incorrect code. Okay, whenever we are coding, we have to follow first conventions and provided by the CMS. After that, client specific guidelines. Okay. Yeah, alphabetical index and tabular list. ICD-10 is divided into alphabetical list and alphabetical listing of all the diseases terms and their corresponding codes. And the tabular list is a structured list of codes divided into chapters based on the body systems or conditions. The alphabetical index will be a index in alphabetical order. We have to go through the index first, and after finding any link to that code, or we will directly go to the tabular list based on the chapter specific codes. Okay, here we are searching for pneumonia. Okay, pneumonia. EUMONIA. It will be routing to J18.9. Pneumonia with the young among cities will go. Yeah, you see pneumonia alba. It is going to A code. It is a different congenital syphilis like that. Okay, the tab index listing is on the based on the alphabetical order. Mediastinum, pneumonitis, pneumonia. It will follow the alphabetical order, but tabular listing will be not generated using the alphabetical index. They are divided by chapters. One GI, it is by infectious, it is J, whatever the code we are getting, pneumonia alba is going to infectious and parasitic diseases. If you are going pneumonia, lung abscess, it is going to stuck. Yeah, 18 point abscess of lung and mediastinum, it is going to respiratory system codes. Okay, they are tabular listing is categorized as based on the system in either respiratory system, genitourinary system, cardiovascular system, and all these things. Okay, if you search in the CAD, coronary artery disease. Okay, coronary artery disease. It will go show you in the late syphilis like that. Okay, in the infectious disease part. Okay, it is not correct. We have to go by diseases. Okay, first start in the index coronary artery disease. Coronary artery C condition. Disease. Okay. Stenosis. If they found any stenosis in the coronary artery, you have to go to stenosis artery cerebral, atherosclerosis, artery NEC, celiac, any stenosis in the coronary artery. If for suppose the patient has a coronary artery disease with respect to the coronary artery. Okay, we have to go for artery NEC, cerebral, extremities, paracerebral, pulmonary, renal, stent, coronary. Coronary with the stent, it will go to this code. Peripheral means with stent in any stenosis in the stent already placed, it is go to D82 series. Any stent that is pertaining to the leg peripheral, it is go to the bile duct. Stenosis of the bile duct, it will go to K83. Congenital, it is by birth Q44.3, bladder neck. You have to stenosis, go to coronary. Coronary, C disease, heart, ischemic, atherosclerotic. You have to click this. It will show you ischemic heart diseases. It is go to disease of the circulatory system, I25.10. Okay, atherosclerotic heart disease of the native coronary artery without angina pectoris. If they mentioned any factor angina, we have to go take this. Okay, if they any further specification is there, na it will go to it will show you plus symbol. Okay, time is gone. It will be disconnected. I will I will connect in 5 minutes and continue. Okay. It is already 12:37 p.m. It is a free version. It will be discontinuing. Plus, it is plus showing. You have to click that. I will take a small break and I'll connect. If you click, you have to take the heart disease of native coronary artery with unstable angina pectoris. If they develop unstable angina pectoris, it is you have to take this code. Angina pectoris is native coronary artery with angina pectoris documented spasm. It will go to I-25-111. And the heart disease native artery with other forms of angina pectoris. If they documented some angina pectoris but not classified in the classification system, we have to code this. If it is the doctor didn't give any pectoris angina pectoris specification, it will go to I-25 to 25.119. It will add to our code. Okay, have to go like this. I-25-119. Have to add diagnosis. I-25-119. I am discontinuing. I will continue wherever I left. Okay.